Ozempic, Wegovy, they're semiglutide. Mounjaro, Zepbound, they're tirzepatide. Hi, I'm Dr. John Schmidt. I'm going to break all these down for you today and let you know the mechanism of action. Are they the right medications for you? What side effects might you have? Will you be successful on these medications? There's a lot to talk about. So I'm going to back up to the OG first, Ozempic. I was prescribing Ozempic way before it was cool, way before it hit the TikTok crowd for my diabetic patients. And when it first came out, I was finding some really interesting things that, man, it was really helping with their hemoglobin A1Cs. Their blood sugar was getting dramatically better, but there were also some unexpected but fantastic side effects, and that was weight loss. I had patients back in the day that were diabetics, and part of being a diabetic, a lot of diabetics have issues with weight management. So what I was seeing with these patients is they were dropping a lot of weight. 20 pounds, 30 pounds, 40 pounds, 50 pounds. I had patients drop 100 pounds on Ozempic back in the day before it was cool. And this started catching on, and we started learning more about Ozempic as physicians, as scientists, and then the general population too. Wegovy was approved then for weight loss specifically, but it was not a diabetic medication. So you had Ozempic for diabetes and Wegovy for weight loss. Then more recently now we have a couple more choices. We have Mounjaro and we have Zepbound. And those are very similar. They've got an added ingredient to them. And they're approved for a few more things, including like sleep apnea. So we have found a lot of good benefits from these medications, but there's some side effects too. So let's get into the meat and potatoes of this thing here. So first of all, let's start with Ozempic and semaglutide. What is it? Well, it's a GLP1 agonist. What does that mean? Well, there's something called glucagon-like peptide 1, which we use in our gastric tract. And basically one of the things that it does is it increases insulin for us. It delays gastric emptying, so it slows down how you process food. It actually lowers glucagon release into the bloodstream, so that's how it works as a diabetic medication, and it makes you feel fuller sooner. Okay, so it mimics the existing hormones that we have in our body, but it lasts a whole lot longer. So it lasts about a week. That's why when you're on these medications, they're once a week injectable medication. So my experience with these things, now I mentioned before that I've been giving it to patients for a long time. Not every patient, very important. Only patients that really are appropriate for that medication. What have I found? Well, I mentioned about the diabetics where they were losing weight. So I now have patients coming in, which a lot of people do, and they want to go on these medications exclusively and specifically for weight loss. Big difference from our diabetic patients. And there was a lull in time there where we really squashed how many patients we were giving these medications to, because what happened was there was a shortage on it, essentially, is what happened. First, when we approved it for, well, not we, when it was approved for weight loss, it was for BMI of greater than 40, and then they lowered it to 35, and then 30, and then BMI of 27 with a comorbidity like you have high blood pressure or something like that, which fit the vast majority of the population of the United States is above BMI of 27. So there was a lot of people that had access to that medication. And then the TikTok crowd jumped in on it and it became cool, and some celebrities jumped on it too. And then there's a shortage of the medication. So one of the bad things that happened was there was a difficult era where people had a hard time getting the medication when they were diabetics and had been on this medication for a while. So that caused some problems. So then the industry kind of pulled back and said, well, we're not paying for this stuff anymore. And it's harder and harder to get covered by insurance is really the thing. So when I look at these patients that are on this medication, and let's say for weight loss exclusively. So I have a patient coming in and they're not happy with their weight and they have a high BMI. And for me, I look at it versus risk versus reward with any medication. My thought process always, number one, do whatever you can to get yourself in a healthy state. And I don't mean lose weight. I don't mean what the scale says. I mean, be physically active, feel healthy, be happy with yourself. And that's kind of where we start this thing. I don't have a magic weight for every single person because I don't think it exists. There's some loose guidelines that we have. But what I have noticed with patients going on these medications is a few things. One, they use it as a catalyst to kind of get things going. So what we'll see in a lot of times is a positive feedback loop where, they're using this medication, they're starting to lose weight. As they're losing weight, they're feeling better about themselves. Now, hey, I'm not so embarrassed to go to the gym. So now they're going to the gym. They're going to the gym, they're making better food choices, and so on and so on. And pretty soon their life has dramatically improved as a result of it. But it's not without consequence too. So we have to be really careful with these medications. That's why I'm not a big fan of just going by fly-by-night online services. You need to actually talk to a real doctor who knows what they're doing and has experience with these medications, because there's real consequences if it's misused. Okay. And I've seen it firsthand with patients. So we're going to talk about some things and some studies, and then I'm going to get into some of the side effects too. But let's talk about the study. So not all weight loss is the same, right? So, okay, you can lose 20 pounds, but what is that composition of weight loss? And that's the thing. So there was a study that came out. Initially, it was a step one study. It was in the New England Journal of Medicine, and it showed that most people on this medication over a 68-week time frame lost about 15% of their total body weight. So if we just kind of extrapolate that in numbers, if someone went in at 200 pounds, they would lose roughly 30 pounds, and so on. If you were 300 pounds, people lost 45 pounds on average. But some follow-up studies came back and they researched it a little bit further, and they said, hey, all right, you're losing weight. That's fantastic. What is the composition of that weight loss? Are you using body fat? Are you losing muscle mass? Are you losing water weight, etc.? So there were a couple of articles that came out. There was one that came out in the Lancet, which is a well-notarized medical journal. And what it said was people were losing about 40% lean mass and the remainder in body fat. Okay, so when we look that down, it's significant. That's a significant amount of muscle mass that one might lose when they're on this medication. There's another study that came out in the UK that showed about a 50-50 split, and I've even read studies that show 60-40 negative, so 60% muscle mass, 40% body fat. Now, here's the catch to it, okay? Those studies that were done typically were people who were sedentary, okay? So they weren't hitting the gym hard, they weren't watching their protein, they were literally living their lives that got them into the position they were in of a high BMI. They didn't change anything other than they took medication and essentially they just ate less. That was it. So when we look at those things, and if you compare that to, let's just say, a bodybuilder, right? So if you got a bodybuilder that's prepping for a show, they're trying to cut weight, but they're trying to maximize their muscle mass at the same time that they're trying to lose body fat. And that's really what we should be looking at doing is getting that body fat to a lower range. Because, by the way, in the United States, I'm going to let you guess what the average body fat for people is. And this is an average person walking around any store in town. So for women, it's 40% body fat on average across all age dynamics. Some studies say 38, but in men, it's about 28% on average over all age demographics. So that's significant, okay? So when we're looking at that, we would really rather lose that body fat than the muscle mass. So when we kind of put all these things together, you have to develop a strategy on this. Now, we also have to look at some things and see like what is, tolerated and their side effects of these medications. And just practically speaking in my clinic, okay, the most common side effects I see from that are two things. One is pain at the injection site, and that is like the first time people do it just because they get a little aggressive with the pin and it's a teeny tiny one to begin with. And then the other one is nausea. Now I haven't taken the medication, but it's been described to me as it's like if you were to eat a huge Thanksgiving meal and you just feel that stuffed feeling and you just don't want to eat it anymore. So that's more common. Now, some other symptoms you can have are GI upset, diarrhea, constipation. I've seen people with fatigue. I've actually seen some people get headaches from it. Those are the more common ones, but they're not super common. And in my practice, I'm going to tell you, it's a small percentage of people who actually stop this medication as a result of the side effects. So they're generally pretty well tolerated. Some serious side effects, though, that I've seen, and I have a couple of patients that this has happened to. I did not prescribe them the medication. They came to me on it. I have two different patients that have a kidney failure as a result of strictly taking Ozempic. So we have to be careful. So with that in mind, we need to make a plan for this. Now, one exclusion to that is if you have a family history of thyroid cancer, you really should not be taking it and you really need to talk to your doctor first. But if we start to structure a plan on how to successfully use these medications, if that's what a patient of mine was going to do, okay? So I don't try to talk them out of it. I just really try to say, hey, I'm going to lay out your pathway for you and you choose how you want to do this because you're an adult. So what we look at doing is a few things. Number one, if you're going to use this medication, if you're going to use it for weight loss, use it as a catalyst for weight loss, okay? Use it as a springboard to get you going and to make good choices in life. Because when we look at some of the studies, we get similar results sometimes to people who went and had, like, say, a gastric sleeve or a gastric bypass. There's a large element of people that are successful after that time, but there's a significant number of people who regain the weight and then more. And if we go back to thinking about that, where, hey, let's say you lose 40 pounds, but 20 pounds of it's muscle and 20 pounds of it is body fat, and 3 years later, you gain that 40 pounds back because of lifestyle choices. Now you're 20 pounds muscle down. So something to really think about before you take this. So how do we avoid that, or at least minimize that? Well, if we go back to talking about like what a bodybuilder might do before they're prepping for a show and they're trying to lose body fat, what do? they lift weights. Okay. So integral to using Ozempic or, semiglutide, which is Ozempic, and Wegovy, tirzepatide, which is Mounjaro, and Zepbound, one must lift weights or at least do resistance training, critical to this process. The other thing is you need to get your protein up. Okay. Now, there's a ton of different varying degrees of, hey, have this much protein, have this much protein, have a gram per pound, have a gram per kilo. The way I usually tell patients is, if women, I usually try to get them up to about 100 grams of protein at least per day, and men about 150. Bonus points if you're going over that. Okay, a lot of people usually do not have that much protein in their diet. So if you're doing those two things in combination, high protein diets and working out regularly with weights or resistance training, you're likely to retain more of the muscle mass. Now, how much of that is going to be retained? Really hard to say. So I've seen some studies and I've had some patients scanned and they've lost maybe say 10% muscle mass and then more like in the 90-80% range of body fat, which is pretty exceptional, but they've worked really hard. I have one person that I know very well in particular who is very close to me that has used this medication in the past. And this person was a high level athlete and experienced some setbacks in life, physical things that happen, surgeries and whatnot, and had a conversation with me about this medication. And I wasn't sure that I was on board because it was kind of, someone I knew, and talked it through. And this person used the medication and did extraordinarily well over the course of the year with it, but used it as a springboard and got back their life and said, hey, you know what? I remember what it was like to work out on a regular basis and I feel great. I remember what it was like to eat healthy. I remember what it was like to not have alcohol on a relatively frequent basis, and my life is better for it. So that's kind of the way I approach these medications is, if you're going to use it as a starting point to develop great habits for the rest of your life. So you are not one of the people who go on it for 22 months is the average amount of time, by the way, who goes on it for 22 months and then comes back a year later and gained all the weight back again because you didn't fundamentally change what you were doing to get you there in the first place. So, kind of final verdict on this stuff. Amazing for diabetics. I love this medication for diabetics. All these four in this bigger group of these types of medications, I love them. For weight loss, are they effective? Absolutely, they're effective. No doubt about it. I very rarely see anybody who does not lose weight on this medications, but again, it doesn't come without risk. So, talk to your doctor in detail about it. Talk to your nutritionist, develop a great plan. Talk to your trainer. If you have a workout trainer, talk to them to develop a plan to make sure you're doing the strength training along with it. So that's pretty much the long and short of all these medications. I hope this was helpful. I'm going to put a short version of this as well. If you like this kind of content, like and subscribe, share. It helps me out. I want to keep bringing you more information. I want to grow together. I want to work together, and I want to be successful together. I'm Dr. John Schmidt, always on call. Thanks for stopping by.